More than 500,000 Kancare recipients could lose their coverage at the end of the month. KOAM Shagun Bomdale joins us in studio this morning with more. Good morning, Shagun.
Thank you, Tanya. At the start of the 2020 COVID-19 pandemic, Congress enacted the Family First Coronavirus Response Act, which included a provision that states Medicaid programs keep recipients continuously enrolled. 3 years later, the continuous enrollment provision is set to expire on March 31st, and states including Kansas are starting to redetermine annual eligibility for all their Medicaid recipients. More than 500,000 Kancare recipients are on the verge of losing their eligibility for Medicaid as the states move forward with eligibility redeterminations for more Kancare recipients.
Over the last few years, during the public health emergency due to COVID-19, anyone that has had Medicaid, right, in our region, that's primarily Kancare, Sooner Care, or Mo Health Net, anyone that has had those coverage plans has not had to do a Medicaid renewal.
The renewals are an abbreviated version of Medicaid application.
An abbreviated version of the Medicaid application that you would do each year to maintain your coverage, report changes to your income or your health status or your household. And so the last few years, that has all been paused.
Ghanaian says recipients should look out for a letter.
Each month, a portion of the population will receive their letters. Again, and on those letters will be information about whether you'll be able to continue your coverage. You may have to submit some documentation, turn some paperwork back into the state, or that letter may also notify you of an end date for your coverage and that you're no longer eligible.
Community Health Center of Southeast Kansas is making the changes known to the public.
If you've been putting off a dental appointment or an exam or vaccines, get those things scheduled. Go see your primary care provider now, and then be looking for that letter in the mailbox.
Some patients will no longer be eligible due to income, age, or health status change.
All right, well, thanks, Shagun. I am curious, though, if you don't get that letter telling you that there's this process going on, what can you do?
I think the first thing to do is go to your local community health center, because that's where you get more information. That's where they'll tell you what you need to do if you're still eligible to qualify or not. And if you've recently had your address change or had your income change, I think it is very important to go now to your nearest community health center to figure out what you need to do to be eligible for Medicaid or Medicare.
Okay, again, that date, March 31st, is coming up this Friday. All right, thank you.